Good morning. I'm Arturo Weschler. I'm co-founder and chief medical officer of Hilarium, a company developing a system for self-management support and patient engagement. I'm happy to speak here just 30 years after I was graduated as a physician here from the School of Medicine in the Technion. So, according to this very quoted report from the IMS, today we have almost more than 40,000 medical mobile health applications on iPhone. If we look at those 40,000, most of them are limited, simple functionality. Most of them are downloaded less than 100 times. So it is very difficult, for example, for a physician to know exactly what are the real interventions or mobile health intervention he needs. We have, from those 40,000, more than 2,000 condition-specific applications. So for mental health, we have over 500 applications. For endocrine disease, most of them diabetes, we have more than 200 applications for diabetes. And for cardiovascular disease, we have more than 100 applications. So this is a very difficult area, and we have to think about the future. I don't think we have 200 medications for diabetes. We have more than 200 applications. I think that this should be familiar for you. You wrote it. So mobile health is emerging as a patchwork of incompatible applications, serving narrow needs, multiple siloed, non-communicating disease-specific application, and everyone is built as a closed application with its own data format and no compatibility. So what did we do? We are another application. But I will explain why we are different. So our main platform is, we call it Personal Health Assistant. It provides the patient with a full integration of all his personal health management ecosystem. We provide an easy integration of other application trackers for nutrition, for physical activity, for medications, using a direct interface on a third party. We use a third party for integrating data from home measurement devices, and we provide the system as a web-based or a mobile intervention with exactly the same functionality. What is our main innovation? Our main innovation is that we separated the intervention creation from the intervention delivery. So from the intervention delivery, we have the personal health assistant. The main innovation there is to activate the patient using daily tasks. So any type of intervention or clinical guideline can be translated with the language we created into daily tasks, and the patient is activated using daily tasks. But our main innovation is the creation of a system for authoring intervention, mobile health interventions. So we have created actually a language, we call it IML, Intervention Modeling Language, with all the semantics and the syntax needed for creating intervention. You can create using this language nutrition intervention, physical activity intervention, a full disease management intervention with medication, or even a cognitive behavior therapy for depression. So using this approach, we can create for one platform any type of intervention, and just one mobile health application and a huge amount of intervention. The best analogy is to the ebook reader. You have one application, an ebook reader, and you have a full range of books on your shelf. So you can use the PHA, the Personal Health Assistant, for any type of intervention. A cardiac rehabilitation from Mayo Clinic, diabetes management from Joslin Center, and so on. And you can load your personal health assistant with any type of intervention created using our language. So one application that covers all the range from wellness management for healthy people to catastrophic condition and case management, what we call more remote patient monitoring and the high end of the mobile health. 4 components or 4 technologies that are fully embedded in this personal health assistant. We have those actionable care plans, the task for daily activations, gamification, a lot of gamification issues to create the right motivation, points, badge, competitions, and a lot of motivation technology. Personal health metrics taken from the field of business intelligence. The patient is managing his health, so we provide the data in a way using trends analysis and key health indicators like in BI, and a social network fully embedded into the solution. We are not only creating the ecosystem of the patient, we also integrate into the full self-management ecosystem, providing interface to the electronic medical record for the physician, and he can prescribe the intervention from within his EMR. The patient can also do self-enrollment using from another portal. From the care manager, we have a care manager application in order to control the process, and the patient with the application we spoke about.
Wonderful.